Hello, my name's Steve Turner. I wanted to say something in this short video blog about sharing information. It was brought into my mind by the recent publication of the Managing Medicines for Adults Receiving Social Care in the Community guidance. I've also come across some myths about information sharing when I've worked in substance misuse and community paediatrics. Basically, if you're working across organisations and you have a care plan around the patient's medicines, it would be unsafe not to share that information. And I've occasionally heard people say, oh, we have trouble sharing it with other people, etc. But you need to balance the risks and what you're doing and what the information is being used for. So if you're providing a service that's about delivering or administering or supplying medicines to a patient, which other agencies also deal with, for example, home care services, then as long as you've got an agreed care plan with the patient, that this is what they want you to do, this is who is going to be delivering it, it doesn't matter who they work for. You really need to share that information. And that agreed care plan with the patient or whoever is acting appropriately for the patient gives you that implied consent to do that. For the thing you're talking about in the care plan, for the purposes that you said it was about, you can also ask the patient at the start, do you consent to this being shared across organisations? What worries me is sometimes people think they can't share information when actually it would be a risk if you didn't. The ideal is to have a shared governance arrangement around medicines sharing, which I've worked on a couple of projects which really worked well, where all the organisations got together and they had one governance policy around medicines and sharing information around medicines. So basically, it is a myth to say you can't share information that's relevant to something in that patient's care plan. And as long as it's relevant to that the patient has agreed and signed up to that care plan, for the sake of safety, you must do it, and it's common sense anyway. This is a personal blog. I am a Nice Medicines and Prescribing Associate, but it's something I feel really strongly about, and I want to make sure that there's an open discussion about this and that people are not acting on information that they think is a correct information governance and is in the Data Protection Act when it isn't. Thanks.